Hi, I'm Toni Pollin. I'm an Associate Professor at the University of Maryland School of Medicine, and I run the Personalized Diabetes Medicine program.
Toni, a lot of people hear that there are two types of diabetes, type 1 and type 2, but you've told me there may be more than two types of diabetes. Tell me a little bit more.
Sure. Well, first of all, the types of diabetes that most people are familiar with and most people do have are type 1 and type 2. But even that is a little bit misleading because actually type 2 has really kind of a lot of different things that could be going on. So in a sense, type 2 even is a lot of different diseases. But there are also people who don't have type 1 or type 2. They have a variety of different specific types of diabetes, and a lot of those types of diabetes fall into the category, maybe 1 or 2% of all people with diabetes, the category called monogenic diabetes.
So what does monogenic diabetes mean?
What it means is that it's a very genetic form of diabetes, and the genetics are different than other forms of diabetes. So genetics and family history play a role in just about all diabetes. And if you have type 2 diabetes in your family or type 1, you're more likely to get it, especially type 2 runs in families. But monogenic diabetes is different because instead of being caused by a complex mixture of genetic factors and lifestyle factors, it's pretty much caused by a change in one single gene in a given individual. Because knowing that you have one of these specific forms of diabetes caused by a change in a specific gene can actually influence what kind of treatment you get for that diabetes and what treatment is most effective. So the real value and power of genetics largely lies in understanding what the genetic changes are, therefore what the changes in the body are and what's causing them, so that you can directly target those changes with how you treat the disease.
Is diabetes something that if my relatives have it, I'm more likely to have it?
Absolutely. Anybody related to you by blood does mean that you're more likely to have diabetes. However, depending on the type of diabetes, genetics may or may not completely tell the whole story. Children can pretty much have any type of diabetes. Now, most children we think of as having type 1 diabetes. That's a type of diabetes where the immune system starts to destroy the body's cells that make insulin, and that's called type 1 diabetes. We used to call it juvenile diabetes. We don't call it juvenile diabetes anymore, in part because it turns out that it can affect people who are not children. But also children can get type 2 diabetes, particularly if they are overweight and sedentary. But that's not even really the whole story, because besides being able to get type 1 diabetes or type 2 diabetes, some children with diabetes don't actually have either of those types. They actually have a single gene form of diabetes. And so you may assume, and the danger sometimes, or the concern is that you may assume that they have type 1 diabetes. And if a person has type 1 diabetes, then you start giving them insulin injections. If a child doesn't seem to be producing insulin, then giving the child insulin makes sense. However, you might be able to give the child even better treatment that's safer, that's more effective, that directly targets the problem. If you knew, for example, that child actually could make insulin but needed a different drug, a safer oral drug, to actually help the child to release that insulin into the bloodstream.
So if I want to ask my doctor to make sure that my child is receiving the right treatment for their specific type of diabetes, what questions should I ask my doctor?
You could ask your doctor if the doctor thinks your child has monogenic diabetes. You can also ask your doctor if your child has had testing for certain types of molecules called antibodies that distinguish between type 1 diabetes and type 2 diabetes and other types of diabetes. Whether the child has had a test called C-peptide. If the child is on insulin, then the C-peptide test can tell you if a child who is taking insulin is also producing insulin on his or her own. So those are the kinds of things you could look at. There are also a couple of reputable websites that you can use to try to find the information.